Well, good morning, everyone. I'm Dr. Ernest Joseph Barthelemy. I'm the Chief Resident in Neurosurgery at the Mount Sinai Health System. And I'm very happy to join you to present on the state of surgical care in Haiti for the conference this morning. So we'll go ahead and get started. I have no financial disclosures to make. My only disclosure would be a cultural one. I am Haitian American, very passionate about this topic and about all topics related to healthcare and social justice in Haiti. So Haiti is the only low-income country in the Americas, and the World Bank defines low-income countries as low-income economies uh, in which the GNI per capita was $1,035 or less. Okay, and this was 2019 data, and you can see here in this list of low-income countries, Haiti is the only country from Latin America appearing here, and you can see where the others are, mostly coming from the African continent, as well as South Asia and the Middle East. So Haiti is unique in the Americas, and I've shown a close-up of Haiti here, which occupies the western third of the island shared by Haiti and the Dominican Republic. And what you can see very clearly is the uniqueness of Haiti's economic state as represented by the color legend here. And so this is an important underpinning of the current state of healthcare and specifically global surgery in Haiti. So if we look at Haiti and benchmark it, it's challenging to benchmark in this region given its uniqueness in economic terms. But you can see very clearly that at least by the three global surgery indicators for which we have any data, Haiti has dismally low stats here. So in terms of the surgical specialist workforce available by provider per 100,000, the number here is 5.9 compared to the Lancet Commission's target of 20 by the year 2030. And this is in comparison to 11 in Jamaica. If we look at Jamaica's 2014 data, Cuba's 100.9 figure from 2017, and then the US is 54.7. If we look at Haiti in terms of people at risk of impoverishing expenditure as a result of surgical care, the 2017 data gives us a 58% figure, and that compares in the manner you can see to the other countries represented here for which we have data. And the target, of course, is 0% people at risk, so 100% financial protection by 2030. And similarly, for catastrophic expenditure, the number is quite high in Haiti, 55.7%, according to the 2017 data, which again compares unfavorably to the other countries shown here. And for those who know a bit about Haiti and the country's history and how we got here, these numbers aren't surprising. And when we consider that roughly a similar number, so in this 55 to 60% range, or perhaps a little higher, of the country is very impoverished, is living below the poverty line of, I believe it's approximately $2 a day. And so, poverty contextualizes a lot of the challenges that Haiti faces, and this is a post-colonial economic debility. So, a bit of an understanding of Haiti's history, which is beyond the scope of this presentation, will help us understand how this country, which uniquely liberated itself from its colonial powers in 1804 and became the second independent nation in the Western Hemisphere, the first nation of formerly enslaved Africans who liberated themselves. Well, this country was punished for this, and the geopolitical context and consequences of this fact led to a lot of the impoverishment that Haiti now suffers. More recently, people learned about Haiti through the, hold on one second here. Okay. More recently, people learned about Haiti through the natural disasters that the country has suffered, in particular the earthquake in 2010, hurricanes and floods. Those who follow Haitian current events know of the recent political turmoil and corruption that has posed a significant challenge as the population has demonstrated strongly against this corruption, and quite frankly, a legacy of corruption that is related to Haiti's geopolitical situation and status. There's significant health system fragmentation, so an NGO problem, which hopefully I'll get a chance to speak to during our panel session, but it isolates local providers and makes it difficult for the surgical system and other parts of the health system to thrive. And then Haiti suffers the worst brain drain in the world, according to some measures. And this this World Economic Forum data demonstrates as much. This was published in The Economist a couple of years ago. Many reasons for the brain drain, which hopefully, again, I'll get a chance to address in our panel discussion. And we hope to lead towards some solutions. And so here I've posted some solutions to consider for Haiti, both internally and in terms of how foreign partners can assist Haiti in a rendering of social justice for the Haitian people. So with that, these are my references. Merci en pile, that's the Haitian Creole term for thank you very much. And you can follow me on social media at the signatures at the bottom. Thank you again for your attention.